Thank you for listening to the Dental Student Vibes podcast, where it's all about good vibes. This is episode 8, Operative Dentistry, one of the more exciting subjects in dental school. Today, we're going to tell you how to cop an A in Op. Be sure to follow us on Instagram at dental.student.vibes, on Twitter and on Facebook. And please leave us a comment, some stars, and subscribe to us on Apple Podcasts. Thanks for listening. So how's Operative been for everyone?
I think it's been really good. It's been a lot better for me compared to our other SimLab class, which was dentures last semester, which I had a little bit of trouble in. But learning how to prep class 1s, class 2s, class 5s with the drill has been a lot of fun. It's kind of just getting to go in there and just do your own thing, and you got to follow the didactic measurements, and then learning how to restore the tooth, amalgam, and composite has really been a little bit of artwork and just really fancy and stuff. So I really enjoyed Operative so far.
Right. George, you were really good last time I saw your Operative preps. You've been on the upward climb like an exponential curve.
Yes, sir.
Let out your feelings to me. Tell me, how's it been?
It's been quite the journey. The first day of Operative was probably my hardest day of dental school, but when you keep practicing, you go into the lab on weekends after school, then eventually it just hits you.
Right, and it does just kind of hit you. So we started out with prepping. What was that thing called? It was called Ergonomics. That's what it was.
Yeah.
It was basically this little square block that had multiple layers that's supposed to simulate enamel, dentin, etc.
Mm-hmm.
And you're supposed to cut these little squiggly lines and stuff in it.
It had shapes too.
I never even finished mine, but it was cool. I liked it.
Yeah.
It was like a coloring book for dental students, just drill inside the lines.
Right. So Matt, how long did it take you till you felt comfortable actually drilling in the mannequin? We started on just the tabletop preps, then we went to the mannequin. How long did that take?
So for some reason my mannequin never works. There's always a problem with it. So I just kind of have to adapt. So I learned relatively quickly to just drill and then be comfortable because something never works. My suction doesn't work, so then I got to suck the water out because then the teeth start floating.
You do it you use a straw or what?
Yeah, as I'm doing it, I keep a bendy straw and I just drink the water out of it.
The water, you gotta stay hydrated.
Yeah, so I'm constantly revitalizing as I'm going, so I can just drill for hours because of that. But no, honestly, I do feel comfortable because it's a lot easier than drilling in a patient's mouth, because when you think about it, they're not gonna say ouch, they're not gonna move.
Right, and you can also cover their nose with your hands and. Patients got to breathe.
I've seen some people leaning on top.
Yeah, when you get real lazy,
mannequins.
I'll just put my chin on the mannequin's forehead.
I do try and be conscious of that though, because I don't want to form a bad habit to where when I do actually see a patient, my hands all over their face and covering their eyes. I don't want to be cuddling with the patient.
Yeah,
but some patients would want it.
Maybe
some patients, that's true.
You don't know what's going on. But no, the other thing too is, I do try to practice, good posture, ergonomics. But when you're in lab practicing for a practical for 3, 4, 5, 6 hours, you start getting tired. So then you start getting lazy, and it's just the hand motion. You just want to get the repetition down. So I might lean my elbow on his forehead or his chest, or I put my head down on it and just keep drilling. Because you just do what you got to do.
You tell the patient it's okay to just lean your elbow on their forehead.
Listen, I've been doing this for 6 hours. Leave me alone.
Yeah. So, anyways, all right. Give me your top 3 most difficult procedures that we've done so far. Think about. Well, what do we have for our practical? Was
class 2 on a prep on number 30, and then amalgam restoration on number 19.
Right. What do you think's harder, composite or amalgam?
Composite. I 100% think composite. Amalgam it shapes pretty nicely, and I think versus composite, it moves around a lot, unless you're curing it, obviously. Mm-hmm. But I still feel like there's a technique to composite that I haven't fully mastered. But once I get that down, I think composite will be a bit more easy.
What's your favorite instrument to use to shape the composite?
To shape the composite, I like to use the paint, the brush. What is that brush?
Oh, you do use it?
I just started using it recently.
What do you use it for? Adapt to the
and then it, when you want a smooth surface on the composite before you cure it, it gives you a really smooth finish.
You're gonna have to teach me that.
Yeah, it's that. I was surprised, because I've seen it in a lot of videos.
Yeah.
And then I think some of the second years said that they use that as well. And I was like, it's been in the kit forever, so I just
Right.
took it out.
Somebody showed me this technique where you take one of your micro brushes, you dip it in some isopropyl alcohol, and then when you're trying to adapt the composite to the margin, you just dip it and then you just kind of brush it and it kind of blends it along. I don't know how good that is for the composite though, because it's
I see what you mean.
Yeah.
So I guess, but with that, you would get pretty nice adaptation to the cable surface margin.
Yeah, I just don't know. I think honestly, when we're actually out there and practicing, we want to be touching as few number of instruments. All right, so let's talk about systems now, because one of the biggest things to begin our efficiency. First of all, how long did it take you guys your first full composite and your preparation?
Over
My
3
first
hours.
full prep and restaurant.
A couple days.
2-3 hours.
2-3 hours.
minimum.
A couple days.
Well, because you get 3 hours in lab, so it
Yeah.
took the class 1 prep. Sad to say, I had to do it a couple times before one took, so maybe 3 hours to get that done,
Yeah.
and then 3 hours to restore.
Right. So the number one way, according to Dr. Greg, who's the helpful dentist, he's the guy who started Dental Clinical Pearls, that Facebook group. Really helpful website. We'll put it in the show notes. He says the number one way is not to drill faster, like physically move your hand faster, because you don't want to mess up your quality, but it's to create systems to do. It ultimately comes down to doing less movements, right?
Yeah.
The less number of times you need to take your eyes off the mannequin and look at your bench top to pick up an instrument or whatever, the more focused you'll be and the more time you'll save. So like we can whittle it down to let's pray that we're going to be able to whittle it down to 20-30 minutes.
Well, I've noticed as the semesters progress that my preps, like not only just the class 1s where it's occlusal, even my slot preps when I'm dropping the box, I'm doing them so much quicker now.
Yeah.
I think it's just all repetition.
Right.
Like some of the hardest procedures that we had done, like let's say like a complex class 2 or something that would take me a few hours. Now I'm doing it in like an hour, under an hour.
Describe what a complex
A
class
complex
is.
class 2 is usually when you do the occlusal surface, you drop at least one box, whether it's on the mesial or distal. You can obviously do both, which would be considered an MOD. And then you're doing like a facial or a lingual surface where you can put a box on one of those sides. You can add a shoulder. You can take down a cusp completely. We do things didactically and we have specific measurements in SimLab,
Right.
but when
Right.
we're in actual clinical environment, it's just going to be based on where the carries are. But they're just kind of teaching us all these different examples. So that's why it's complex.
Right.
But it is challenging, and I feel like as we just do it more, it just gets easier. It's crazy to think about.
It is. Another important tip for our listeners is, according to Dr. Greg, and I totally agree with this, and I'm sure every dentist out there will agree with this, the fewer number of burrs that you use, the more time you're going to save. So you need to practice all the time with the same burr. One of the burrs that we are recommended to use all the time is, of course, the
330.
330. All right, so I'm glad we're all on the same page.
I actually like using the 245 now.
Really?
To be honest, even when I'm doing my class 1s. But the problem is obviously you have to angle the burr as well when you're doing a class 1 to get the
Converging walls.
Yeah, converging
Yeah.
walls, yeah. Because since the 330 is like pear-shaped, it gives you the converging
Right.
walls as a...
The inverted cone.
Yeah.
I'm a big fan of the 56 high speed because it's smaller than the 245, so it's more versatile. You can put it in the box, do whatever you need to do, and it's easier to angle so you don't nick the opposite side of the tooth while you're dropping the box to add convergence.
Now, question: do you use that just to like smooth out like your areas, or do you actually use that to perform?
I do it.
prep?
Yeah.
I use everything. So
So-
I'll do the 56 high speed set at 40,000 with water, and I'll run through the entire prep, and then I drop it to 20,000 without water, and then that's what I use to smooth, rather than switching to a slow speed at a similar with a 56 on there at a similar RPM and running it through. It just saves it's efficient because I could just press a button and then change it from my memory thing on the mannequin, and I run through it. So I could just save a few minutes, and that adds up because when you have 3 hours to do in lab when you're practicing to do a prep and a restoration, you need all the time you can get. Plus, you also want to work on your efficiency, like
Right.
you said.
Yeah, exactly, Matt. Exactly what you're saying. Another thing for efficiency, one of our preceptors explained to me that when we're using the same burr for everything, that includes using instruments. So if we can replace using an instrument with just using the burr and just still holding on to the same handpiece and just keep it going, that will save you a lot of time. It'll be much more efficient. So an example is when you're drilling your class 2, you drill the occlusal outline, you drop the box, or however order you want to do it. And then when you drop the box, you always have that enamel shell towards the interproximal space, right? And so you, in a certain way, you can get rid of that enamel shell with your burr. Haven't really figured out how to do that yet.
The way I do that with the shell, you're right. I keep the shell and it's maybe like 0.5 millimeter in thickness, and then I actually drop. It doesn't matter what burr it is, but I drop it down to maybe 5,000 or 6,000 RPM dry.
Right.
And then I know if I take it and break the shell, even if I get close to the adjacent tooth, it's probably not going to damage it because I'm at such a low speed already. So that's usually what I do. But I think it's hard to, you're right, because with the hand instruments, it takes a lot of time. It's really, really time consuming. And I think if you can master the comfort level that you have with the drill, it helps so much just because you steady your hand a lot more than you used to be able to do. So you can work in those tight spaces, whereas maybe before when you started, you couldn't really work in the tight spaces.
I know we said we don't want to change burrs, but I've noticed like a mosquito burr, just for like a recommendation, helps with that. For those little areas. Seth also really helped me with the hatchet too.
Oh yeah.
Once you told me some hatchet tricks, and Cosmo actually did as well. And
some hat tricks or hatchet tricks?
Well, hat tricks are awesome, but
I'm playing soccer over here.
Pasternak scored a hat trick last night. But if you learn how to use the hatchet properly, it really is a game changer.
So a couple things with the hatchet,
and
right?
keep them sharp as well.
Yeah. Number one, keep your instrument sharp. But so obviously you can cut off the enamel. What are those called? The enamel hooks. Yeah.
The overhang?
Cut those. Yeah, it's a hook overhang. Cut it off with your hatchet. Another thing is I saw on Stevenson Dental Solutions Fire Video series, Fire Video channel. They've got all the tips and tricks. I think that's probably one of the best ways to learn how to do preparations and any restorative work. Anyways, I saw on there if you drill down and you drop your box, but you have a full wall of the shell, then you put the hatchet into the box and then you kind of flick the entire wall, and you keep doing that. I know you're supposed to do that initially, but if you keep doing that and you keep dropping it like a couple, like fraction, 0.1 of a millimeter, and you keep popping off a little more and a little more, you'll eventually get to your exact depth that you want, which is a nice technique. I know it's a little bit hard to visualize, but you can see that if you go to Stevenson Dental Solutions on YouTube. You just type that in or Google it.
And you know the other reason I think the enamel shell works for me is because when I put a matrix band in, it feels like I'm looking down a black hole sometimes, like it's just really difficult to see. But with the enamel shell, like you don't have to worry about being kind of blocked off because that matrix band, it comes pretty high. And unless I guess you could trim it down if you wanted to, but I personally think it's too much.
So how did you guys prepare for your practical? So we had the practical. We've had 2 practicals so far this semester. We've got one more as our final. Our first practical was, you said,
first practical was class 1 composite restoration.
Just a class 1, and then the composite filling. Second practical, class 2, and
we didn't even have
amalgam filling.
Sorry, I didn't mean to interrupt you, but we didn't even do a prep for the first practical.
Oh, we didn't?
No, we did that.
We were able to do it.
I think.
We were able to bring the prep already done.
Yeah.
But we didn't have to actually do a prep. So the second practical where we did the class 2 was the first time we did a prep.
Right.
On a practical.
Right.
Which is kind of scary. Yeah.
But it's all repetition.
Yeah.
I mean, I don't know about these guys, but I practice consistently for like a week. I would go in
so
for
tell
a couple
tell
hours.
me exactly. All right, walk into school. Tell me step by step, Matt, what you're going to do.
Go to school, walk to the sim lab, take a deep breath, throw in my AirPods, gather all my instruments, set them out in my order.
Throwing your AirPods, that helps. It's focused.
For me, I mean, I love operative, I love drilling, I love filling. It's almost therapeutic. If I'm having a bad day and I want to get away, if I don't feel like going to the gym, I'll go straight to lab.
When do you not feel like going to the gym?
I mean,
it's grind time and it's shine time, and that's all the time.
It's the glorious house of gains. But some days you just need to take a break. So, no, but for real though, I'll go to lab, I'll lay out my instruments. So, it depends on what I'm doing. So, for class 1 restoration, if I'm doing composite, I only use 2 instruments to actually fill it. I use the plastic instrument with the spatula on it, kind of shaped like a hockey stick, and then I use the Explorer, and I use that to just feel around and everything. So, I use those 2 things. I don't have to I don't have to drill afterwards. I don't have to finish. I just do it very well. It's a love connection. You just treat it well, and then it'll come out very nice, and it's less work in the long run. Then but for the most recent practical, when we had to do the class 2 and drop the box, I just did lots and lots of preps. I did at least 15 and 20 teeth just practicing. I would do it slowly, try to get the mechanics down, try to get a rhythm going of what I can do and repeat it.
I think I was in the sim lab, like during the weekends, probably at 6 or 7 hours a day.
Yeah.
Just
A
because.
day?
Yeah, like, and I remember like.
Dude, the time goes by really fast.
Yes,
Oh, yeah.
dude, it really does. Like, I remember getting in there like 12:30 one day, and then I was like 4:30, and I felt like I had been there for 30 minutes or something. But it's fun at the same time.
Yeah, it's fun.
And you just hit, like, there's that point where you hit, and you're like, okay, now I got it down.
Yeah.
Absolutely. And you can feel yourself getting more confident.
Yeah.
Another tip for the listeners when they're in operative and they're trying to plan out all these things, I think pretty much every school uses that big brown sheet of paper on your bench top.
Yeah.
And so you take your Sharpie or pen or whatever and you write down, first of all, when you're practicing, make a list, because we all, like we just said, we take forever, right, when we're practicing. So make a list of the things you need to get done. And then also when you're either in sim lab and you're being taught, I always write down all the steps of the procedure, and then I always write down my own personal system that I use. So like this burr, then this burr, and then this burr specifically for driving the box, and then pick up this. And like if you can get that down really well, you'll have your system down, you'll be super fast, and then eventually when you get into practice, like I said, I was an assistant, so when I was assisting, I knew exactly the instrument that the doctor would need, and I would hand it to them. No words would be spoken. I would just hand it, and they would hand back. And like that's the relationship you're supposed to have with your assistant. And then of course we all know you got to teach your assistants. Like that is what the end goal is. You're gonna teach the assistants, and you guys are gonna be the dynamic team.
I think that the chemistry between an assistant and a dentist is very underrated because, like you were saying, you have to be able to do everything at the right time because the procedure hinges on that, you know. If you don't have the chemistry, then it kind of slows things down, makes you less efficient. Like Seth was mentioning, having a plan and a plan before you go in and actually do the procedure helps so much. It really does. Just staying organized and having a plan is probably the biggest piece of advice I could give to people.
Absolutely. And speaking of systems, again, I know we keep bringing this up. Dr. Barrett, who we're going to have on the podcast in a future episode, he's the clinical director for Greenberg Dental, and he goes around and he teaches everybody the Barrett protocol. I saw this in a newsletter the other day. I think it's a great name because the protocol, you know the protocol, and you become super efficient. And that's how you can really advance your skill set.
Yeah, absolutely.
Right? So, guys, any tips for the amalgam restorations?
George, I saw you did quite a lot of them, right? So
Yeah, I did a few of them.
Well, first of all, what's your favorite instrument to use for the amalgam versus the composite?
For the amalgam,
Yeah.
probably the carver and the acorn burnisher.
Right.
the acorn burnisher was money, dude.
Yeah.
I love that.
I didn't realize that
What was-
until like 2 weeks in.
Right.
I remember you told me to use a couple. It was the football burnisher
Right.
and
So
then the Hollenbach carver.
There's a system for
Yeah,
this, right?
what was-
Okay.
yeah.
So we place all the amalgam with the condenser. Then here's the system for it. This is called the money system. This is patented and copyrighted by Dental Student Vibes. So the method is you condense it, and of course you increase your condenser size as you condense more. Then you use the football, the blunt end of the football, and you go back and forth lingual buckle across the cavo-surface margin, and then you take the sharp end of the football, and then you start drawing your groove, right? Your central groove, and you do one line at a time. You don't do the whole groove at once. You go this line angle, then this line angle, then this line angle, one line angle at a time. And then after that, you should be ready to start taking out the excess. So you take your cleoid disc. I know I'm using a lot of instruments, but use your cleoid discoid. You scrape off the excess using the cleoid from the cavo-surface margin. And then finally, to make your thing look too legit to quit, you got to use the Hollenbach carver. And then there's a special way to use a Hollenbach carver. You have the one that's shaped like, what would you even call it? Like a
spade.
Spade?
Well, there's one that's looks like a hockey stick when you look at it from the side. Then there's one that has the the cutting edge is 90 degrees to the handle. So
it's like a
right. So that edge you use to sharpen your central groove. Then your hockey sticks end of the Hollenbach carver you use to do those exit ramps to make those secondary grooves, and you're looking like money.
And then at the end, the nail biter, when you put in that articulating paper, you close and you start doing like eccentric movements and all that stuff, and then you pull it away and there's nothing left on the metal surface, on the amalgam surface. You're like, yeah, I'm done. I'm done.
Hell yeah.
And remember, a little floss in between the interproximal areas.
Yeah.
Make sure we get that.
Super
pop.
crucial.
Wait, hold on. Do it one more time.
Pretty spot on. Anyways, so also we got to know the anatomy for making all of these restorations, right? How did you guys learn anatomy, the dental anatomy, to know exactly how to make them?
We learned it in one of our first classes, actually, in dental school. So I feel like our school set it up really well for us that way. But if that's not how someone else who's listening might have that, I think anatomy, for especially like the occlusal surface, is it's just repetition. Like you start to learn that, like, like a first molar has like the M shape and the Y shape, and they kind of like come across each other. And then like a class 2, you make more like a cross shape, and it's just kind of like, I feel like repeating it is the best way to help it. But there's a lot of grooves and little triangular ridges and little details that I think you just learn by just researching and just trying to make sure that you focus on that, because it's really important on grading, and it's really important on when you do your ADEX.
Right, yeah. And then, of course, what we did when we learned dental anatomy, we had the lab and we did our wax ups, and that really, that's when I really started, it just clicked for me.
Learning the anatomy of it. I felt like we stare at these teeth like for so many hours a week that exactly. I think I just have the image of the tooth burned into my mind.
I learned mine more from tooth ID than
tooth ID?
Waxing personally.
Yeah.
I try to visualize the tooth, because you want to try to recreate what was there initially, because you want to get it back into function, because depending on whatever you're working on, but you want it to occlude well still. You don't want any marks for the articulating paper, and then you have to start shaving down or whatever, so I try to get it right the first time. So I try to take a mental image in my head of the plastic tooth, and granted, all the teeth are the same, but once you get to clinic and everything, and you're working on actual patients, everyone's teeth are going to be different. They're going to have slight, idiosyncrasies, so you got to remember those to
It's a nice word.
input that in.
Idiosyncrasies.
Yeah, my SAT vocab word for the
Very nice.
So
that's a great point, though. That's a great point. Because what I just said kind of contradicts it, because I'm burning the image of a plastic tooth in my head versus, yeah, you're right, with a real patient, it's going to be different.
Because some people, this is getting out there, but it's like if you have like a cusp of Carabelli or whatever, and you gotta, if there's like...
What is a cusp of Carabelli?
It's one of those little extra
little extensions, right?
Yeah, the little extra cusp. What is it? The maxillary molar. So, I studied, but if you have carious lesions on these, you're gonna have to fix what you take away. You can't just cut away something and then just say, oh, it's gone, and then forget about it. So you want to be able to recreate what you remove.
Because then you'll have problems with occlusion, and then you'll have more problems.
Exactly.
But, all right. So, anyways, when we're really getting down into the nitty gritty here, what do you think helps you the most when you're speaking with your professors? Like, what will set one professor apart that really helps you, and what doesn't help you?
Yeah, I think the thing with us is. It's really easy to get discouraged, but you have to realize that you're doing this for the first time, and some people by you, they'll get it straight away, and then you're sitting there, after an hour after they've finished their work, still sitting there wondering, why can I not get this down? But when you come to the faculty members and you ask them a couple of questions, they're really, really willing to help you, a couple tips and tricks, because I don't know which burr to use sometimes.
Yeah, Dr. Stanford crushes.
He's really, really helpful.
He's a real one.
He's the man with the same thing with Dr. Notter. He knows his stuff.
They know the tips and tricks that you're not going to learn necessarily from just the lectures, which I think is really important.
Yeah, you got to be out in the field.
Yeah, you got to get to know them, because they're going to help you. They want you to be good. They want to pass on their knowledge. That's why they're here.
Yeah.
So I would just recommend talking to them, getting to know them, and then when you're actually doing your work, I feel like they'll want to help you too.
Honestly, I just want to, I bug them, no matter who it is, I'll go up and ask them 1,000 times, hey, what do you think? Hey, what do you think? I don't care, because at the end of the day, it's on us, right? We're the ones who are going to have to produce that amazing result. So, But so why do you think it's okay to fail? Let's go on to another subject here.
Because you'll never do it again. At least for me. If I do something wrong, I will never do that thing wrong again.
Why don't you do it again?
Because I strive for perfection. I mean, that's just what I do. So if I do something wrong, I mean, I'll beat myself up. I'll get annoyed at myself, and then from there, I say, okay, this is what I need to do, and I make it a very, very deliberate thing to keep working, and then not do that anymore. So if I don't know, nick the other tooth, I realize don't nick that tooth, and then I'll control my hand. I'll fulcrum better. I'll use a different burr if I have to.
He nicks the tooth, and then he takes out his Sharpie, writes on the paper, "Don't nick that tooth."
Sorry, I thought I was the only one laughing at it. But
I'll be honest.
Mental note.
What you could do is, whatever you do to the tooth, you do to yourself. So you nick the tooth, just poke yourself in the burr.
Get rid of that. On the real, though, on the real, I think it's actually important to fail in something like operative because you need to get repetition. We've talked about it already, that it's the best way to learn, and I think someone like myself, when I fail in operative, I get frustrated, I get annoyed, and I kind of have a similar mindset to Matt, where I don't want to do it again. But adjacent tooth damage, I think, was the hardest part for me in class too, and it took me hours of just practicing after SimLab, learning how to get proper burr angulation. But I wouldn't have learned how to do all that stuff if I didn't fail.
Yeah, I know. I 100% agree with you guys. It can get so frustrating sometimes, but I think all of us, this speaks for all of us over here, and I'm sure a lot of people who listen to us, you don't want to be average. You want to be the best at your craft.
Right.
And you have to have the confidence to do it. And I don't like ever being left behind. And I think you have to have that fear of failure in a way, because that's what pushes you to get even better at it.
Right.
And it's okay to fail. It's absolutely okay to fail. I accepted that when I started dental school, because, sometimes there's moments where you just go through life and everything's running well, and then you forget what it feels like to get down on yourself. But you have to be able to be prepared to take risks, figure out what's a good technique for you, figure out what's not a good technique for you. That's the only way you're going to learn.
Right. When you have those obstacles in front of you, you're just not doing well with your preps. You got to just survive, you got to thrive, and you just got to grind, No matter what obstacles you got in front of you, you think about your past accomplishments, and you just keep moving forwards.
Yeah. Because I think everyone goes through periods in their life where things are difficult, but you just got to pick yourself back up and you just go for it.
And it's like our teacher said, they're not necessarily failures, they're more learning opportunities.
Right.
Yeah.
Thank you, Tony.
It's all about getting learnt and getting turned. You know what I'm saying? You know what I'm saying?
No, I'm saying.
All right. So the number one tip you could give to incoming pre-dental students, dental students who are about to take operative.
Do you want to just go around the table?
Let's do it.
Patience and repetition, honestly. Just keep working at it, and you're not gonna. And nobody's just naturally good. Usually, if you are, I'm jelly. But honestly, just keep working, and you will get better. You will pick up tricks, and then you will develop your style.
Right.
Yeah, I completely agree. Mine's kind of the same thing. Learn. Most importantly, you need to learn what you're doing, because if you don't understand it, you're not going to know. Make your mistakes, because with your mistakes, you're going to turn your weaknesses into strengths if you keep practicing them, and just have fun with it. This is a learning experience. It is called SimLab for a reason. It's not real life. Just take it one step at a time, and I promise things will get better, and you'll reach your goal eventually.
Right.
Yeah, just keep practicing. Do it over and over.
How many times, George?
And over.
How many times before you
over?
How many times before the practical?
2, 3.
Realistically, before the practical, say you're doing a number 30 prep, I would do it twice.
Twice?
The weekend before.
I have a handful of 30 preps.
I'm saying minimum twice. If you don't have time on your hands.
Seth's dropped more boxes than Amazon during the holidays.
That was probably the best line we've had this year so far.
That's a Vibes Hall of Fame joke right there. Very nice.
Like I said, though, just keep practicing. And if you get bored, it doesn't matter. You can mess around. I saw Seth drilling giant holes in his teeth.
I remember seeing this typed on one time. This was probably like the first 2 weeks of class. Every single tooth has a filling in it, or it's prepped, and I'm like, when did you do this?
My
haven't even got to that tooth yet.
My favorite thing is they say replace all the teeth. You need virgin teeth for the practical to turn it in. And he's like, Matt, do you have any extra wisdom teeth? It's like nobody has extra wisdom. He's like, oh, I already drilled in mine. So you're a SOL guy.
Anyway,
too much fun.
I had to replace the whole typodont.
You have to order a new one.
Yeah.
Anyway, going back to advice. For me, this is not gonna speak for everyone, but I would say the biggest piece of advice I could give to anyone is when you're in lab, focus on yourself, block out everything that's going on around you in terms of the other students, because I had a really bad habit that I formed early on in the semester where I would compare myself to others in terms of how quickly was I doing this, how neat and tidy did it look, but that's probably the worst thing you can do, because at the end of the day, when you're practicing, there's not going to be anyone else around you. You know, none of your friends will be around you. None of your like fellow dental students will be around you. It's just you, and you have the responsibility to be able to produce the work for it. So just focus on yourself.
Right, and I think that's good when you're actually preparing the teeth, right?
Yeah.
But it's also good, like we're doing right now, to talk everything
Compare
out.
ideas,
What's your, how do you do this? How do you do that sort of thing?
Yeah, that is such a valuable resource. Not even just faculty, it's the students around you. Like some people, like they'll have this technique that really works well for you. And I think having that, like, we have such a good like composition in our class over here where you can go to anyone in your class and ask them, hey, how did you do this? Or what worked well for you? And it's really, really nice to be able to do that.
Yeah.
Helps out so much.
Absolutely. I want to talk about a couple things here for final tips to give anybody a better experience with their first operative session. First of all, of course, learn, make mistakes, and have fun. But let's talk some details here, okay?
Let's put a little detail action in there.
Make your system, practice it once, and write out exactly what you're going to do. Write it out on a piece of paper, and it'll make you just kind of see everything flow a lot better. The next thing is to assess yourself, right? They say that a million times.
Yeah.
Assess yourself. What is dentistry without assessing yourself?
Yeah.
Right? You never know how good, if you're even ready to be done with your procedure, unless you assess yourself, have I done all of these things?
And I think that's something that our teachers have really put into our brains, because I know personally, me, when I used to do assignments, when I was done, I was like, done, here, is it good? If not, but I think the fact that they make us grade ourselves before they grade us is a lifelong lesson, not only in dentistry and outside dentistry, but it's so important because you need to be the one who's signing off on your own work when you're in practice.
Right. Yeah, definitely. And then the third tip, I think, is, we didn't even touch on this, but the third tip is when you prepare your tabletop, have everything exactly where you want it to be, have everything lined up in the order that you're going to use it. One of the things that I do, I take a paper towel, I put it on the brown piece of paper, and then you do your filling after you drill, obviously. Yeah. So I take all of my filling materials, such as the plastic instrument for the composite, or also the composite gun and the slow speed and the polishers. I take all those things and I put it on a paper towel just so that it's in its own section. Right, so you just look, because when you're going really fast, you're trying to get procedures completed, you're just throwing stuff. So if you have everything exactly in a certain order on your tabletop, it's very helpful, and you'll move a lot faster.
The other nice thing is the burr blocks are organized as well, and it will say which number is on there. Mm-hmm. And I think I don't even have to look anymore, because I know exactly which row it's in, and which spot my 330 is, which spot my 56 is, my 245. But yes, I agree with you. Organization is very, very key. And then also another technique I like to use is drawing the outline of what I'm going to drill with a pencil.
Right.
And it keeps your measurements accurate as well. So it's really, really nice to have that down, especially when I was dropping boxes or trying to get the clearance with the interproximal. Mm-hmm. It was really nice to have it measured out.
So draw it on the actual tooth?
On the plastic tooth, right. Yeah, so I draw where my measurements are going to be. And I stay relatively conservative because we are measured on a certain standard, of measurements. So I like to go conservative, and then I want to give myself room to polish or smoothen things out.
Right.
So.
Do you like to use the pencil on the patient's tooth as well?
I mean, we're not ready to
I guess you could.
Everything
I
goes.
guess you could, but I don't want them to get lead poisoning. So
Yeah. Very.
I mean, the
very
patient has
flexible.
caries. So
Yeah.
you gotta draw it on.
Yeah. All right. Well, I hope you guys found something valuable from this episode. We try and give you some tips. If you have any other questions about how to progress in operative, any other suggestions for the podcast, hit us up at dental.student.vibes on Instagram, Twitter, also Facebook. And then, of course, please leave a comment, subscribe, and give us a few stars, preferably 5, on Apple iTunes. So thank you guys for listening.